Yeah, so the project we're reporting on in this meeting was a multi-center prospective phase 2 trial of continuous EPD maintenance after second autologous stem cell transplant. And the cohort we enrolled in this is patients between the age of 18 and 75 who had received an upfront autologous transplant and had either 1 or 2 lines of therapy prior to salvage, prior to their second autologous transplant. And the study design was that after the patient went through salvage, we would put them on continuous EPD maintenance, 28-day cycles, using the 2 milligrams of Pomalidomide on days 1 through 21, and then receiving Elotuzumab every other week for the first 6 cycles, and then dosed monthly after that with Dexamethasone dosed on the day that they received Elotuzumab. So this is a trial we were trying to enroll 40 patients on due to some shifts in the treatment of myeloma recently. We actually ended up closing the trial early due to slow enrollment, and only 18 patients proceeded on to the maintenance arm of this study. The efficacy in this group of patients was pretty good compared to historical controls. Our primary endpoint was 1-year PFS, which was 72% on our cohort. And then when we looked at our median PFS, it was about 29 months. It's very challenging sometimes to interpret the literature regarding second autologous transplant. The 2 landmark studies that were done, the Myeloma 10 relapse trial that came out of the UK, and then the German relapse study were both done mainly in patients that hadn't been exposed to lenalidomide in the frontline setting as part of their maintenance regimen after transplant. But if you look at some of the more recent data, we'd say that 29 months is pretty good given the cohort that we enrolled. I think the other notable thing is that the combination of EPD, as we've seen in some of the relapse trials for multiple myeloma, is very tolerable, that really we had a low rate of discontinuation related to treatment toxicity, and that our rate of adverse events in the trial was also very low.